Welcome back to Sunday Live. In studio with us. We're happy to host the Director of Medical Services, Dr. Nicholas Muraguri, because we're looking forward to discussing matters of health in the country. Thank you for joining us.
Thank you so much.
Before we go into the interview, we've had views coming in, and we just want to take a look at some of the tweets that you've sent. Let's have a look at what you think about healthcare in the country. We've been asking, what are your views on healthcare in Kenya? And at this Mr. says, we are far from having a healthy nation. Access to quality health services remains elusive. At Eric Kogi says, health has really improved, and I'm really impressed with measures taken by both national and county governments. Eric, I wish we knew where you were. At James Palando says, healthcare in Kenya is quite wanting, more so for the poor that need government support, especially on serious health cases. Let's just address those. So there are some people who are saying, you know, it seems to be getting better. But for many people, especially for those who are struggling with the costs of living, there's a feeling that it's inaccessible. First of all, even accessing healthcare facilities in the first place, and when you get there, the costs still seem restrictive. Again, there's the issue of lack of availability of equipment. We know what cancer is doing to Kenya, and let's address perhaps cancer specifically. What do people do across the country if they find that, you know, they have a problem with something like cancer? Maybe we can start with your views on these wide issues.
So, I mean, overall, we must agree that we have come from far. It was worse before and is improving progressively over time. Both national and county government are investing a lot of money to improve the delivery of health services. But there are bigger plans. For example, with the county government, we're improving infrastructure, improving health, human resource development. We are also supporting the county government with more, specialized health services. That's why we're equipping all of them to be able to diagnose things like cancer at the county level. It's not acceptable that, a lady with a lump of the breast in Lodwar must drive all the way to Eldoret to have a mammography taken. That's not right. 50 years of independence. So this is why we are working together to improve infrastructure, to improve human resources and the quality of care. At the same time, we also address the issue of access in terms of financial barriers. That is why we are reforming National Health Insurance Fund, so that it can cover more and more Kenyans. So that the idea of Harambee, whenever you are sick, should be a thing of the past soon.
So, you can hear me dying to come in here and ask the simplest questions. We saw what happened in Garissa. The attack was shocking, and perhaps more shocking, and we've been discussing this, is the fact that people had to be airlifted for healthcare services. That in Garissa, it could not cope. But you just look at a situation and ask, what does that mean? That means that people every day in Garissa just don't have the healthcare that they should have. We know there's been a push and pull between some county governments and implementation of health strategies and the national government through the ministry. So how are these being resolved? And can we say that we need a minimal standard of health care services and institutions in every county, and any county that does not fall in line can be held accountable? So
what we have done, we have defined what we call a minimum package of care. And that is why we went out of our way to support county government with equipment so they can meet that level of standards.
Some refused to take the equipment.
It's very unfortunate, because those equipment belong to the people. And for example, look at the situation in Garissa. Because of lack of theatres, we were forced to airlift people 1 hour ride to Nairobi. Otherwise, if this project had been finalized in Garissa, we could be having brand new theatres, equipment. All that I could have done in Nairobi is send additional surgeons to help them manage the cases in Garissa. The vision we have is that every county government should be able to have capacity to manage medical emergencies, from whether terrorism, from road traffic accidents, all even natural disasters. So ICUs, theatre equipment are minimum standards for every Kenyan, wherever they live.
Okay, so the plan is in place, and you are trying to push it forward. Let's go now to the statistics that have come out. And the fact that Kenya, which as I was growing up when I was young, I think we had one of the highest birth rates in the world. Those rates are coming down, I think 3 point something now.
3.9,
3.9. We're seeing improvements in maternal health care. We're seeing improvements in child mortality. So these are all good things. We're making some progress. What did we get right?
So what has happened, it clearly shows our policies are working. Let's start with delivering in health facilities. 5 years ago...
So once a mother gets to a health facility and actually delivers
a healthy baby. So 5 years ago, 44%, only 44% of children were born in health facility. Today, we're talking about 61%. It clearly says that the free maternity program is working. The fact that we have now mothers who are well educated, so free education is working because we have now a mother who is more exposed than before. So all those combinations, including expansion of infrastructure, county government have opened up more delivery rooms than before, equipped them, employed more health workers. All those factors contribute to a better package. In fact, in public health facilities, the number of women delivering have doubled. Let's look at a place like Nakuru County Referral Hospital. They used to deliver only 500 per month. Now they're delivering 1,000 women per month. So clearly showing some of the policies that we put in place, like free maternity, is changing the lives of Kenyans. And delivering health facilities is really the foundation for everything for children. Children being taken care of better, the mothers like to survive and go home with a healthy baby.
And with the information they need to keep the baby
healthy and themselves healthy, including family planning as well, which is another bigger story that Kenyans need to celebrate. You know, before only 46% were women were using family planning. Today, it has gone up to 58%. That's a remarkable improvement. And all that means is that now women are getting their babies when they want to get the babies. So they're likely to be more healthy, children are likely to be surviving, and that's the foundation for transformation of this country. Let's
go to the bad news now. Yes. And I am not one who loves bad news, but we must confront this. Stunted growth in children in this country, the figures show it's over 20%, I believe. Also, shockingly, and for me perhaps, I don't know how many others will be shocked about this, FGM prevalence in the country, that's female genital mutilation. Again, I think it's 21% across the country. Now, what are we getting wrong? How do we address this?
So let's start with the children. It was worse off before. So the level of stunting was 35%, is now 25%. Still bad, but some improvement. If you look at
what is the primary cause of stunted growth in children?
So stunting growth shows basically two things. It is an experience of chronic malnutrition. That's why you get stunting, and a couple of diseases in between. So we have improved, and shows that maybe we are breastfeeding more, which is a fact now. 60%, I mean 60% of our children breastfed at least 6 months and above. Before it was 30%, which is an improvement. Level of care. So when children are sick, they're receiving better care. A sick child never feeds. And also quality of food is improving. So over time we have seen an improvement. So the stunting was 35%, now it's 25%. It can be better. But we also need to celebrate the achievement we have achieved as of progress.
Okay, I'm going to ask you in a moment how we make sure it improves even more. Just to say very quickly to women, please breastfeed your children. For me, it was a must. For some of my children, it was 2 years. But the difference that it makes, and the healthcare professionals will tell you, it makes an incredible, especially mandatory for the first 6 months, if you can.
For FGM, is a very sad story for women. But I strongly believe that we can do something about it. If you look at the countries, communities across the country, look at even Baringo. The levels were very high before, but the president, former President Moi, came out very strongly and put a campaign, and it almost stopped. So it is possible, even in communities we think it cannot change, it can change. That is why now in Baringo the rates are coming low. We are looking at statistics between 15 to all the 43. The younger girls are less likely to be circumcised than it was 5 years ago. So still we are making progress, but it needs to be abolished completely. And it is possible to stop it.
We're making progress perhaps too slowly, might be the question. Let's go back to how to bring up healthy families. We're seeing, and HIV/AIDS, of course, has been a major focus for many years. Where are we in the fight against HIV/AIDS? Can we breathe? Can we sigh in relief, or are we still facing a huge challenge?
We have a huge challenge, but also need to celebrate the success. It was 14%. Just 10 years ago. We are now talking about 5.6%. Of course, with huge disparities in our country, we now have a clear roadmap, what we call a prevention roadmap, that is going to sort out these problems. We know, for example, over 65% of our new infections are only in 9 counties in this country. So if we zoom into those 9 counties, we are likely to turn the tide. I think the end of AIDS is possible in this country if we're able to have very high coverage of what is known to work. Male circumcision, treatment, testing, and the DHS, the Demographic Health Survey, really showed some marked improvement. For example, testing rates among men and women. Over half of the women have been tested, and 46% of the men had tested the last 1 year. So major improvement. We are far from it, but we are almost there.
I'm sorry, I'm coming in because we're nearly closing the show, and I'm getting some very interesting tweets here. Somebody says, I think health services are still poor in some marginalized regions. Let's reach them and make them feel like Kenyans. That's from Naomi. And the question I'll ask is, how do you force county governments? You say you have a plan in place, but how do you prod? And another one that I think is very interesting, can the director address the Pumwani theft of babies? This is a very controversial story, a horrifying story of mothers who find out that perhaps a baby that they were told was dead was actually stolen. What are you doing about that? Let us start with the marginalized areas.
So let's start with the marginalized. There are two groups that are marginalized. One is the urban poor. In fact, is worrying that the child in the slums of this country are more likely to die than a child in rural areas. Then, of course, we have those nomadic environments, communities, the former northeastern part of North Rift regions, former North Rift regions, which were isolated, and the access services were an issue. The county government addressing part of it, and we are going to support county government. In Nairobi, for example, we already started opening clinics, more fixed clinics, beyond zero clinics, in the slums. For example, Kibera has 9. Shockingly, to date, in 3 months, we have 20,000 mothers and children who access care in Kibera. Clearly showing that those people were unable to access.
This was a completely marginalized community.
It's not around. We are now going to Mathare and other slums. From there we go to Mombasa and Kisumu. So urban slums is an area that was completely neglected. We were seeing children who had been immunized for the first time, and you get shocked. Where were they? It looks like Kenyatta Hospital is very near. It's not. That mother must, during the day, go make an income, make a living, get a living. So the time she comes home is 5, the clinic is closed, her child will never be immunized. Now with the system we are putting in place, it's open at 8 o'clock, next door, she can go have child immunized and then go to her workplace.
Right, so it's setting an example. It's a precedent that can be replicated.
Yeah, so we are starting Kibera, so urban slums, and we're also working now with the county government to look how we need to bring services closer. So the idea of mobile clinics for Beyond Zero by Her Excellency is exactly to that, to reach the Kenyans we have not been able to reach with fixed facilities. Because how they live their lives, they're nomadics, we need to follow them. Right. They have every right.
We need to adapt to their
lifestyle.
pattern.
Yeah.
Now, very quickly, the issue of Pumwani, and this really is trafficking. I mean, there's no two words. It looks like it's the sale of children, the stealing and the trafficking of babies. It's a criminal issue. But if there have been cartels doing this, how is the ministry playing a role in disbanding them? So
that issue of Pumwani is very disturbing for all of us. But as we stand now, the facts are not known, and it's under police investigation. So on one side, people are saying baby are stolen. On the ground, there are no facts. So that is being investigated. However, is there a fact that these children are being stolen? There are two arms to it. One is criminal nature, and then professional. Any health worker in this country who is involved will be deregistered as to practice as health worker, other than on top of the criminal nature. Right. So there will be a criminal process and also professional process. So the investigations are going on about this issue. It's very disturbing. I have been there several times with the cabinet secretary to address it. It has now gravitated to a labor relations issues, but we are all concerned, like all Kenyans.
We all want
we shall know the truth. We shall know the truth.
Thank you so much, Daktari, for joining us in studio. We could have gone on with this discussion. Perhaps just to wind up is to say to the county governments, to those who are doing well, please welcome us to your counties to take a look at what you're getting right. To those who are not doing well, we should be looking for you, naming and shaming. If you have hospitals that don't have drugs, we have SMSs here, people sending in complaints that don't have drugs, that don't have medical workers, or places where medical workers are even being threatened. This is happening and people don't feel comfortable working in those spaces. We're going to be keeping an eye on it and trying to help improve health services in this country. So if you're doing well, share your story. If you're not, please pick up your socks. We're taking a break now. Asante Daktari for joining us. Stay with Sunday Live.